Hi, Mrs. Liss. So my name is David. I'm a Harper nursing student, so I'm going to be your student nurse for today. So I'm just here to perform a CWA assessment on you. So I'm just going to be asking a couple questions, okay?
Mm-hmm.
So can you tell me, are you experiencing any nausea or do you have any sick feeling in your stomach?
No.
No, okay. And have you vomited recently?
No.
No, okay. And have you had any itching or any pins and needle sensation or any burnings or numbness in your hands or feet or anywhere?
No.
All right, and have you had any sensation of feeling bugs crawling under or on top of your skin?
No.
No? Okay, good. And I'm just going to be checking for tremors, so if you can just hold out your hands and spread your fingers apart. Okay, so I'm not seeing any tremors, so that's good. And I am observing the patient for if the patient is sweating. So I'm not seeing any sweat on the forehead or the neck area. The hands, if I can feel your hands, they're not clammy or damp, so that's good. And are you aware of the sounds around you, the surroundings and the sounds around you?
Yes.
Yeah. Do you hear any noises that you know that aren't there?
No.
No. You don't hear any harsh sounds that disturb you or anything?
No.
Okay. And do you feel nervous at all? Do you feel anxious? Have you felt anxious when you wake up or when you go to bed?
Sometimes.
Sometimes?
Mm-hmm.
Okay. How would you describe it? Is it severe or is it just moderate?
Like
mild? Mild. Okay. And do you have any headache? How does your head feel?
I don't have a headache right now.
Okay. Do you feel like there is a band around your head? Any pressure?
No.
No. Okay. So I see that my patient has a flat effect, a pleasant effect. I see that they aren't agitated or anything like that. So I'm gonna mark 0 for agitation, which is good. And do you know what today is?
Yes, Friday.
Friday, okay. And do you know who you are?
Yes.
Okay. Who are you?
Claudia.
Okay.
Yes.
And do you know who I am?
Yes, David, my nurse.
Yes, yes. Okay, and so that's about it. So your score was a 1, so that's actually good. You just seemed anxious. You just answered that you do have anxious sometimes, mild anxiety, so that's good. So that's really all I needed from the assessment. So I noticed that my patient is having a seizure, so I'm going to immediately, right away, get my patient to a safe spot. It's either on the floor or the bed. So my patient is in the hospital bed. I'm going to restrict any loose clothing. So this is loose, okay? I'm going to turn my patient to the side and not restricting any body movements. And then I'm making sure that there's something soft tucked under the head. So I'm going to put a pillow under the head. Okay, good. And I'm going to make sure that the breathing is patent. She is breathing. I see that the breathing is soft and that the seizure started at about 0800. And I'm just making sure that the breathing is normal, that the breathing isn't, that the respirations aren't less than at least 10 respirations per minute. And I'm just going to be making sure that the patient, I'm going to be noting if the patient is still seizing or not. Okay, once the patient settles down and is recovering, I'm going to keep the patient in recovery position, which is a sideline position. So my patient stopped seizing, so I'm going to keep them in a sideline position. So I'm going to keep this hand this way. Good, and they're in a sideline position. And then once they recover, I'm going to go ahead and ask them if they know who they are and what happened. Mrs. Liss, can you hear me?
Yes.
Do you know what just happened to you?
No.
Okay, so you just experienced a seizure. So I'm noting right now that is 0801. So she had a seizure for about 1 minute. How are you feeling right now, Mrs. Liss?
A little loopy.
A little loopy. Okay. So I'm just going to leave you here. I'm going to be with you for 15 minutes. I'm going to go ahead and grab some vital signs, and then I'm going to administer some post-seizure medication, okay?
Okay.
So at this time, I'm going to document the time. I'm also going to go ahead and notify the physician. So once I've notified the physician, I'm going to go ahead and come back, do vital signs. My patient's blood pressure is 120/80. The heart rate is 74 beats per minute. Her temperature was 97.8. Her O2 saturation was 97%, which is good. She didn't need any oxygen. And her glucose is 93. So all labs and vitals are normal. And I also administered 4 milligrams of lorazepam. Sorry, I had to look at my documentation. Lorazepam. And we administered 2 milligrams of lorazepam through the IV slowly, and it was 2 milligrams per minute. So once my patient is safe, I'm going to stay with my patient for another 30 minutes, make sure that they're not seizing, and then I'm going to go ahead and document. Thank you.